of the following neurological deficits is most consistent with this patient's presentation? 55-year-old man with a history of hypertension and smoking presents to the emergency department with sudden onset of severe back pain and loss of sensation below the waist. On physical examination, he has flaccid paralysis and areflexia in his lower limbs. There's also loss of pain and temp sensation below the level umbilicus, while touch and proprioception are preserved. Okay, which of the following neurological deficits? Okay, this sounds like it's dealing with like an ischemic infarction or stroke of some kind. 55-year-old man, so middle-aged man, upper-aged men, smoker and hypertensive, sudden onset of severe back pain and loss of sensation below the waist. Okay, back pain below the waist. Okay, so flaccid paralysis, areflexia of lower limbs. Lower limbs, I'm already thinking it's going to be like the anterior cerebral artery, maybe that's dealing with lower limbs there. Loss of pain and temp, sensation below the umbilicus, but touch and proprioception are preserved. Okay, pain and temp. Following is most consistent patient presentation. Okay. If they're having an ischemic stroke, flaccid paralysis of the lower limbs, it doesn't say a side. Hypertension, smoking, onset of back pain. I'm not sure what, like, I guess, for this question, I'm not sure what they're asking. I guess I can just say, but I think it's dealing with some kind of lesion to the brain. And then I'm thinking that it has to do with like an ischemic infarction to a certain area that's causing the lower motor neuron manifestations and the upper motor nerve manifestations as well. And then loss of pain and temp is going to be the which not the cortical spinal tract, but it's the
So I guess working through this question is a little bit complicated, right? And I'm never, I'm not 100% sure, right, even on my answer, but let's work through it together, right? So, you have risk factors of stroke, of course, right? You have hypertension and smoking, right? Then all of a sudden he has severe back pain and loss of sensation below the waist. So he can't feel anything below the waist. Okay. And then on exam, he's flaccid paralysis, meaning he cannot move, and he has no reflexes of the lower limbs bilaterally. Okay, so let's stop there first. If you have something that is bilateral, do you think it's a brain issue or a spinal cord issue?
If it's bilateral,
So talk to me like this, right? So let's say I'm going to give you an example. What are the odds of having stroke at an acute stroke at the same time on bilateral hemispheres of the brain?
Oh, okay, I got you. So it would be more of a spine issue.
Yeah, you understand the difference, right? Like that is like very, very unlikely, right? Like for you to have one stroke is unlikely. For you to have a consecutive bilateral stroke on different hemispheres is very, very unlikely. So to me, I'm already locating this as a spine issue, right? Because it's a lot easier to have an issue at the spine of that level, right? Meaning you disconnect everything below it. You understand what I'm saying?
Yeah.
Okay, so more than likely it's a spine issue because it's bilateral lower limbs. Also, they say loss of pain and temperature sensation below the level of the umbilicus, right? So in your mind, right, you should start imagining, right, the cross section of a spinal cord, right? So you're dealing with those what is spinal thalamic tracts, right, which is your pain and temperature, right, which crosses, right? And so in your mind, you're like, okay, so I don't know if it's from the posterior or the anterior end of the spinal cord. And then they say, while touch and proprioception are preserved, which is the dorsal columns. So in your mind, right, something is affecting kind of the anterior part and the middle part of the spinal cord, but the posterior part or the back part or the dorsal part of the spinal cord is okay. So now, right, they say which of the following neurological defects is most consistent with the patient's presentation. So when you look at it, bilateral loss of pain and temperature sensation in the upper limbs. Do you think the upper limbs are affected here?
No.
No, right? It shouldn't, right? It should be everything below whatever is going on. Loss of touch and proprioception in the lower limbs. Is it lost or should it still be there?
They said it's still preserved.
Okay, should exactly right. Should be there. Preserve pain and temperature sensation in the lower limbs.
No, that they said that was lost.
Okay, good. Okay, preserve touch and proprioception in the upper limbs.
No, upper limbs aren't affected. Oh wait, preserved? Yes, that is.
Okay, upper motor neuron signs in the lower limbs.
Um, that they did say there's areflexia in the.
Okay, good. Right. So this should be our answer. Does it make sense how we work through that?
Yeah. Okay.
So you just got to break it down, right? I think sometimes, right, if you cluster everything together, it becomes like this wall of like information where it's just so much to analyze because you're kind of overwhelmed, right? But if you break it down really easily, as in, okay, is this a spinal cord or a brain issue? Oh, it's bilateral, so it's unlikely that they're gonna have a stroke, bilateral side, so unlikely that. Then from there, you kind of work with the physical exam and kind of, talk to yourself about, okay, what can possibly here, what can possibly not be here, right? And then you kind of say, oh, anything in the upper portion of your body shouldn't be affected. You get what I'm saying?
Yeah, I got it.
Okay.